Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashley Thornton, and we're here at the AusACPDM conference in Cairns, Australia, to interview world-leading researchers, clinicians, and people with lived experience
to support your practice in being more evidence-based.
Welcome back to our live conference series at AusACPDM in Cairns, Australia. We are joined by Israt Jahan, who is a nutritional epidemiologist. Very cool. We're going to unpack what that means in a minute. Working with children with CP in low and middle income countries, based at Central Queensland University, Australia. Welcome, Israt.
Thank you. Thank you so much for having me. And yeah, it looks great. Thank you so much.
Oh, we're looking forward to asking lots of questions. First of all, congratulations. You have the very prestigious PhD platform here at the conference.
Yes.
So recognizing some incredible work, and it's very competitive to be able to get one of these positions. So
well done.
Thank you. I was surprised as well.
No, it's definitely not a surprise when you look at your body of work.
Yeah, that's right.
No.
So there's a lot to talk about in just a short space of time. But of course, you've got your papers as well that have been published that people can read. But tell us a little bit about what a nutritional epidemiologist is doing within this space. So how did you come to do this PhD?
Yeah.
That's actually a very interesting question. And I think it's been 7 years I've been working, so I don't have 7 years to explain. I'm sorry about that, but I will try to be gist. So I think that started, I was I'm trained as a nutritionist, and then I was not very happy with being a dietitian only, and wanted to learn more about research, and then which led to study more on public health, and there I majored in epidemiology.
Yeah.
So that's how this nutritional epidemiology came in my training background. In terms of CP and LMIC, it's like I joined CSF Global as a research officer in 2017.
Right.
Where I actually first met a mom of children with cerebral palsy and spoke to them, and I realized how naive I am considering myself as a dietitian because I knew nothing and I had very little to offer. This especially for children with CP and in LMIC context. And I will not get into details all this stuff, and I will keep something for tomorrow. But yes, I think that was it. And I knew that I had to work in this area because when I tried to learn searching internet, it was like everything from upper middle income to high income countries.
Sure.
There was nothing, almost like 1 or 2 papers, I think. Describing what affects the nutritional status of children with CP, and it led to me I have to at least describe the burden, then we can go somewhere from there. So that's where it all started.
Wow.
Yeah.
And could you, I know, again, we can't condense 7 years into 10 or 15 minutes, but could you talk to us a bit about what that burden is in very broad terms? Yeah.
So my first report was from Bangladesh. We used the population-based data from Bangladesh Cerebral Palsy Register, which is the first and ongoing population-based surveillance in any LMIC for children with CP. And we found that 70% of children with CP, which is more than 2 in 3 children with CP actually have underweight or stunted. And I have come across so many kids whose condition we could have prevented if there was something in practice. But then when as a nutritionist, when I get those kids, it's like it's a -3Z score, -4Z score, something from the median, so skinny, malnourished kids, and that time you have to take all this clinical treatment in consideration, and things becomes very complex. So I guess to answer your question, the burden is almost 70%.
Yeah, wow.
But the problem is of that burden, the majority actually has severe undernutrition, not even the mild and moderate.
Right.
But I reckon there is obviously mild and moderate, but we don't detect that early.
Wow.
Yeah. Okay.
Gosh. And so you obviously you identified the problem, you've described that, and that really triggered you into action to try to find a solution. So I guess that leads to this PhD.
Yeah.
What is it in a nutshell that you wanted to capture and help with in your PhD? Like what sort of new knowledge did you want to put out into the world?
Well, I cannot take the whole credit.
Best research is done in teams. Yes.
I have an amazing supervisor and like an excellent team.
Yeah.
So who helped me to capture all these essence of this PhD. I think I wanted to describe 3 main points.
Yeah.
The first one is we knew that I was speaking a little bit earlier at the breakfast session today, that we have evidence gap in terms of describing the burden.
Yes.
Then when it comes to assessing nutritional status, we don't have the tools like wheelchair scales or other advanced tools in low resource setting to get the accurate data.
Yeah.
And then the third is, even if we identify a child with CP who is suffering from malnutrition, what do we do? Because NG-tube feeding and all those advanced technique and interventions that have worked so well is not actually very applicable for LMIC setting. And I did a scoping review as part of my PhD, and there were only 8 articles around the world from LMIC setting. We didn't even go to the quality assessment of those data and everything, but there were only 8 articles. You can imagine.
Yeah.
So I think that led to my third third objective of the research, that I wanted to do something so that we can initiate low resource setting focused intervention.
Yeah. Can I talk a little bit about that, just from a practical sense? Because I've done some work in Southeast Asia, and some of the children that I've worked with there. That's probably what struck me the most was. I was surprised to hear this child was actually not a child, was 18 years old, but was from a size perspective, maybe looked 10, and bony prominences. And the parents, I'd often ask them, so what do they eat? And they'll often say, it's porridge, rice porridge. And they would lie them down on the floor and put it through the mouth that way. And what I'd be used to seeing is a peg and some sort of nutritional supplement. So when you face and see a child in that kind of setting where surgery might not be an option for them, what can you do?
You tell me when you will find. I still don't know, honestly, what we can do. But we had a lot of discussion with other countries from Latin American and Pacific regions. And now I'm not sure if you're familiar about global LMIC CP registers. So the PhD was supported by the global LMIC CP register platform. And we have over 14 countries joining that network now. So every LMIC has their own experience. But the idea is to learn from each other. And I think some solution would work. We are now trying a bit about to the basic level, just making the awareness that your child will become malnourished. So that we don't have to go to that severe step. I mean, not everything is related to food. Obviously, there are other complications.
Sure.
But I think gradually we are talking about community-based program to sensitize around surgical intervention and enhance capacity of the hospitals and clinics, so that all can work together to treat. First option would be prevent. Then is to early detect and manage at community level. And then if needed, then definitely tertiary services.
And I just think about, the children in, say, Australia, for example, and lots of other, high to middle income countries, the complexity of the management of nutrition and the number of teams that are involved at a hospital level or at a community level to manage that for them, and how ongoing that involvement is. These solutions that you're talking about, wanting to develop, they're quite complex, aren't they? When we try to think about the local context and that being a low to middle income country. And
like the basic capacity team that you would need to support proper nutritional guideline for a child. We don't have speech therapists back in the country. I think for a million, there is 0.5 speech therapists. And same thing is happening everywhere. Then we don't have, we have physios at least compared to others. But then dietitian is like, there is also not much experience in clinical sector. But more about public health approach. So we're trying to kind of transitioning. And I feel like we have started a movement rather than. Yesterday, Hannah was telling, I really loved her speech at that. We started the pitch, the journey. Not necessarily I will be able to see the end and outcome, but I'm happy that the talk has started.
That's right.
I'm really happy.
Yeah. And as you said earlier, awareness is a very important first piece of that journey.
Yes.
So you're doing incredible work.
Gosh, absolutely. Absolutely. And so where do you see this going to now? So you've, through a lot of your work now, standardized sort of assessments for people to be aware about this. Awareness is such a big factor. What's the next step?
So technically and infrastructurally, we are now looking at a 7-year program. We call it Global Cerebral Palsy Nutrition Program for LMIC-based settings. It's supported by the GLM-CPI and Cerebral Palsy Alliance Research Foundation.
Amazing.
And we now have some strategic planning. And divided into 3 stages. We have done the pre-implementation phase. Now at the implementation phase, where we are field trialing different strategies, trying to see what mothers want, the caregivers want, because they have to deliver that intervention.
Yeah, that's right.
Absolutely.
Yep.
So they are the most major part of this intervention program. And we hopefully expect that in next 5 years, we will see some progress in this regard. But it's a mix of participatory action research, stakeholders, mothers, and all this advocacy and everything.
Yeah. And you can see, it's great that it's part of a network as well, because at the end of the day, what you do find there'll be great learnings to other countries and not have to keep reinventing the wheel.
Yes.
Because they're commonalities.
Very important.
That is very important. Yes.
So you can see how this work will really influence so much of the world when we think about health equity, and that at the core is what we keep talking about, isn't it?
Yeah.
Goodness me. I think we could talk for a long time.
We really could.
Again, I think we'll say this to everyone. Congratulations on this work and being recognised for it. And,
thank you.
And for all the effort in bringing all these people and the stakeholders together, because it's no small thing to bring people together to come along the journey, and that's why it's a movement, right?
Yes.
Yeah.
Thank you. Thank you so much for inviting me, and it's been really good.
Oh, and all the best for your PhD platform
Thank
tomorrow.
you.
We look forward to supporting you from the audience.
I'm a bit anxious, but thank you so much.
Well,
and what a privilege to be able to share that work.
That's right.
Yes, it is.
Yeah, so to all of our listeners, hope you really enjoyed that and gives you a bit of a taster about what this PhD was all about. So, but stay tuned for more. Talk to you again really soon. Bye.
Thank you.